aquí cerca del aparato y diga cuando empieza ya empezó a proseguir. Okay, we're live. Okay, we're live. So, ladies and gentlemen, this is a bariatric surgery from Obesity Control Center in Baja, Mexico. This is the first live VR 360 transmission now that YouTube has facilitated the platform in order for us to live stream in virtual reality. So for those of you that are new consumers to the technology, please remember that you can, if you're using a laptop or a home computer, you have to use YouTube, obviously, and you can drag the image around and just look around our operating room, look at the hands of the surgeons, turn down as you are hovering on top of the patient who kindly gave us permission to use this live transmission. You can turn around and just browse all around the operating room. Now, if you're using your mobile device, please use the YouTube app. Ya le mandaste a displayed on our high definition display that you are seeing hanging from the operating room ceiling. So we're here at a critical step. This area is the spleen. The spleen is a highly vascular organ which should be treated very, very mildly, as it can bleed profusely. So what we're doing first in this surgery is we're using, well, in modern surgery we use high-end technology. In this case we're using a vibrating device which acts as a cutting and cauterizing instrument. In fact, it vibrates over 55,000 times per second, which separates the molecules. This is basically called ultrasonic dissection. Now, I'm going to pause for a second as soon as I remove this fat, and I'm going to show you the patient's anatomy. As you can see, if you look down on your device or on your computer screen, or even if you're using goggles, which has got to be a trip, you will see that I'm between the patient's legs. My surgical partner here is on the side, moving a camera and the instruments. And the instruments are going through some one-way portals where the instruments can come, but the gas remains inside the belly. And the reason is simply because we want that gas to inflate, to lift the abdominal wall, so we can have here, you're seeing the last and the outlet of the stomach. The outlet of the stomach converts or attaches to the small intestine. What we're doing here is we're separating these ligaments that hold the stomach more or less into place, because we're going to staple it into a smaller sleeve-like looking stomach. Thus the name of the procedure, the gastric sleeve. This is a very popular weight loss procedure. Patients lose a substantial amount of weight and resolve a lot of their additional diseases related to being overweight, like hypertension, high blood pressure, diabetes, high cholesterol, high triglycerides, etc. So we've separated the stomach fully. This is the stomach. This is a very big stomach, of course. And we've got the hiatus. Basically, the hiatus is where the stomach joins the esophagus. As you can see, we can move it back and forth nicely. we're going to ask the anesthesiologist to pass down a tube through the throat, and we're going to use that as a calibration device. So right now, pay your attention on the screen. Go ahead and move your mobile devices or your screen, drag it. Okay, now we're passing this calibration tube, and what we're going to do is we're going to start by doing our first line of staples. This is an interesting device as it creates six rows of staples and then cuts between those lines of staples. So we're effectively dividing the stomach in two. The part that stays is medial, and this guy over here is lateral. So we're going to go ahead and close it, and I'm going to show you how this device works. So you can see a blade right there on the screen. You can turn back and see what my hands are doing, how I'm activating it. That's the beauty of this Live 360. I do not really need to run the risk of having a lot of people in here, but you can effectively see what's going on during the surgical procedure, and you can understand from a dynamic standpoint. This is an incredible 360 VR, especially Live is an incredible teaching tool. So what we're going to do is we're going to do a second line of staples. And if you get close to that monitor, you'll be able to see those small little staples, which I'm going to ask Dr. Martinez here. Small little staples. What did you say about these staples? They're so small that what?
You need reading glasses to see them.
Well, you do.
I do.
All right, if you have any questions, don't hesitate to ask us, but since we're all scrubbed up, we won't be able to answer. This is general anesthesia. Our anesthesiologists have the patient nicely anesthetized. Of course, it is the safest surgery, safest anesthesia for this type of surgery. We're going to do two more staples to fully separate the stomach. Okay. ¿Algo más? Estaban diciendo a Manny que quiero que me infle el estómago, ¿no? And we're going to do this last staple, and again, you are floating on top of the patient, which is something extremely cool and awesome. I can't wait to see the video. And this would be the last staple. And now we've effectively dissected and separated the stomach. Now what we're going to do is we're going to reinforce this staple line. Sometimes you need a little touch up here, magnified, so if we look at it, it would be probably less than 10 drops. Now what we're going to do is we're going to go ahead and anchor our first stitch, and we're going to do a running stitch all the way down. Okay. And you can see the stomach that's been separated, stapled off, has now a different color because, well, we cut off the blood flow. So this is the highest part of the stomach. Okay. And we're going to proceed distally to create a nice second regular seal, if you will, hiding the staple line, as you can see right there, kind of inverting it back into the stomach. And those staples Well, some of them will stay there, some of them will actually tend to fall into the stomach and ultimately down the toilet. So, it takes the mucosa, contrary to popular belief, it starts healing in as little as 6 hours. Wait, one more second. All right, so our nurse is reporting we've been performing surgery 12 minutes so far. So it's kind of like those party balloons when you're trying to inflate a party balloon, and if it's too small, well, you require a lot of pressure to blow into it to start expanding it. So the pressure backs up, more or less like when you're blowing into one of these balloons. When it's half inflated, it's a lot easier for it to inflate. In this case, the analogy would be that the stomach would be more prone to expanding and failing after food starts creating pressure. So this may be considered somewhat labor intensive, but in our practice we've always done it simply because, well, 2 seals are better than 1. Number 2, this really does reinforce the staple line, and even though it is a mechanical stapling, devices are not completely 100% free from failure. So we take a little bit more time and we just go ahead and hand sew this second line. Lastly, we believe that we're not only reinforcing to keep this line from leaking, we're also reinforcing for longevity. Our patients tend not to fail after months or years that the surgery took place. Why? Well, because we create this reinforcement of non-absorbable material that will be permanently reinforcing this staple line and keeping the patient from overexpanding this pouch that could potentially lead to failure.
And we've never had a leakage, right?
And we've never had a leak, which obviously is one of those desirable things. So we're about to finish this procedure. Yes, Mani? Where to?
No.
This is second to the last stitch. And as you can see, we have hidden. What we're going to do now is we're going to remove all this excess liquid. And then we're going to proceed to remove the stomach that has been stapled off. And that we're going to do through an incision. Well, this is the first time that we haven't had to move a camera because, well, basically it's you who moves and not the camera itself. So, Sin interrupciones, ¿verdad? ¿Listo? Okay, posición. Okay, this looks nice and clean. Okay. So right here, you've got the end of the stomach. We're going to remove this stapled off stomach. Then we're going to inflate it for you so you can see the actual size of the stomach. So pay attention if you're looking through your goggles or your headset, or if you're on your mobile device, please look down towards the patient's belly, and you can see how we are extracting the whole stomach. Once it's completely extracted, we will pass it on. There you go. That's the rest of the stomach. And I have just passed it on to the crew, who will help us inflate it. Now what we're going to show you is we're going to look for bleeders, but we're going to show you the new stomach. This is a small, nice looking stomach. You can't see any staples anymore. No hiatal hernia. We've got a small looking stomach. We've got the end of the stomach, which is called the antrum. This is where it converts into small intestine. You've got the gallbladder right here and the liver. You've got a little bit of liquid, which we're going to aspirate, thus negating the need for a